You're welcome back. This is still HealthAfrik, your favorite health show on television today. And on this episode, we are looking at spinal stenosis with Dr. Jerome Boatey. This segment, we are looking at the educational aspect where it's going to benefit the public and the medical students. Now, let's look at the beginning aspect of spinal stenosis. You made mention of some group of professionals that can help manage. Now, as a medical student and in this group, what experience do I need to get to manage spinal stenosis?
So, the most important thing is to what we say the red flags, to identify the red flags. You want to be sure that the condition the patient has in his spine is not going to progress and or cause paralysis. Okay. And these are the red flags in the thing. So, issues about pain that is in the back that is getting worse and is not getting better with the weight loss and the usual massage and painkillers, and or you are getting weakness in your arms and or your legs, or you are getting poor control of your bowel and bladder, and then you have to rush to the bathroom, or things are falling from your hands, or you walk for a while and your legs feel heavy and feel like falling. These are the red flags. So you need to be able to examine the patient and identify these red flags and say, this is not the one you have to wait. Go see the specialist who will then help you and manage you. We don't expect the medical student to go and do surgery on the spine, but at least to be able to identify and help these patients manage, especially the early onset, to identify that this is mild, so you can continue your physical education and therapy, or this has red flags for which I think you need to see a specialist to manage you. Nobody wants to get paralyzed. Nobody wants to get and end up in a wheelchair. And nobody wants to have poor bowel and bladder control. So those are the issues of concern in the general public.
Okay. Now, my last question on this segment is, has there been any collaboration between this institution and educational institution and or research institution in terms of enhancing treatment and diagnosis method for spinal stenosis?
Yes. So basically, what is done in the spine institute, or what we have at the Boatey Center, is basically a way to help evaluate patients as an early onset, so that we want to catch the patient at the early stage, so that we can then prevent the irreversible stage from happening. We also liaise with Korle-Bu, for which I have privileges, and we do teaching there. We teach medical students and residents, and we also do research on spine diseases as well. So yes, and there's also some other conditions of the spine where there's an abnormal curvature, which we also do both at Korle-Bu and the Boatey Center Institute.
Okay, so doctor, we are ending our discussion on spinal stenosis. I would like you to give us your last words to the public and also to the medical students.
Okay, so basically spinal stenosis is something that comes with age, the majority of it, and about 40% of the population has some back pain. And the most important thing is to seek advice early and find ways of slowing down the effect of this on your body, so they don't get to the severe and irreversible stage. And if it is done, you can live a very normal life. Surgery is excellent. There are tests that can be done to identify those who need surgery. It's not everybody who needs surgery. And it's the last stage in the process. So if it's evaluated well and done well, you can live a normal life, a normal fruitful life with surgery and with spinal stenosis. Just seek treatment early so you can avoid the irreversible stage. And can be treated, yes. Can be managed, yes. Can avoid paralysis, Yes.
This is the end of today's episode where we talked on spinal stenosis with Dr. Jerome Boatey. And I have learned that there's no preventive measures for aging, but then we can reduce the effect on our body. My name is Isabella Tita Ahenaka. If you just tune in, you can follow the discussion on our social media handles at Association of African Universities on Facebook and YouTube, AUTV_African Universities on Twitter, and AUTV Official on Instagram. Bye.